Good afternoon and a happy new year to one and all joining us today. With New Year just begun, I'm sure all of us have had our resolutions made. Some of our resolutions are followed throughout the year, some break within a week. But I urge all our diabetic patients to have at least a resolution to follow a good diet throughout the year to have a better control on their sugars. So here we have today with us our senior honorary diabetologist, Dr. Anil Bhoraskar, sir. Thank you so much, sir, for joining us for this session. Sir is the secretary of scientific section of Diabetic Association of India. Sir is a fellow of the Royal College of Physicians, UK. Sir has been a fellow of College of Physicians, India. And Sir has published enormous papers. Sir has shared enormous sessions throughout. And we are privileged to have Sir to talk today with us on New Year resolution for our diabetics on diet. Thank you, Sir. So I would like to ask you, what should be the main constituents of the diet for our patients?
See, Nadia, thanks a lot for your kind introduction. You must understand that New Year always begins, particularly on 31st night. Everybody indulges into some kind of activity which may not be entirely very healthy, you know. And therefore, they decide that, look here, now let 2025, I'm going to do this, I'm going to do this, and particularly going to stay away from all vices and all uh, five poisons, sugar, salt, etc. And they make some kind of resolutions, which are basically to console themselves and to avoid the guilt complex. But many of the resolutions are really designed in such a way that they are based on certain health issues. If a person is hypertensive, he says, well, I'll restrict my salt, I'll restrict my alcohol intake, I'll restrict my fat intake. That's fine. That's a good idea. But the point is that sometimes the resolutions are made which may be unrealistic and impractical. So one has to have a real practical approach. See, for example, the therapy of a diabetic patient is based on four pillars. The four pillars are diet, exercise, and drugs or medications. And fourth is most important is the education about this disease. Without
Right.
education and having a basic information, you can't go ahead. So once these four pillars are properly strengthened and one takes a serious cognizance of these four pillars, I think the life of a diabetic patient would be very comfortable. So traditionally, our diet is divided into four constituents that we all know. Is one is the carbohydrates, which is a mainstay. India is a country where the 90% people have a carbocentric diets because carbohydrates are cheap and easily available. Fats, which are also traditionally consumed in India with a healthy fat, which only recently we are eating wrong kind of fats. Then proteins. Protein is a source of very important substance, but they are expensive. Then comes the minerals and vitamins. So this
Right.
is broadly the division of our diet.
Okay, sir. So, and what about healthy fats? What are healthy fats in our diet?
Now, there is so much of issue on, uh, we virtually call it oil crisis in the life of a diabetic patient because there are continuously inputs coming from vegetable seed oil industry that the healthy fats and so-called cholesterol reducing fats or the phantom of cholesterol is created by the statin lobby in the world. That cholesterol is very bad, you should avoid it. Cholesterol is a very important constituent of your cell wall. It's a very important precursor of many hormones. Without cholesterol, you cannot go ahead. But it is the bad cholesterol or LDL cholesterol which causes thickening of the arteries and causes atherosclerotic disease. The point is The vegetable seed oil have put in so much of money in the oil industry that they are promoting unhealthy fats as a heart friendly good oils, and therefore the fats which have a higher content of omega 6 fatty acid. Fats are divided based on what is the attachment to the carbon ion. Basically, they are the fatty acids are chains of
Right.
carbon containing OH and COOH. Now, this position of carbon decides whether it is at the sixth position or the three position. We call it omega 6 fatty acid and omega 3 fatty acids. Then, based on what happens to the fat at the room temperature, the room temperature, the fat is not frozen, we call it unsaturated fat. If the fat is frozen at the room temperature or in cold season, we call it saturated fats. Now, they feel that saturated fats are bad. It's not
Hmm.
really true. Not all saturated fats are bad. And therefore, fats are divided into saturated fat, polyunsaturated fats, monounsaturated fats, based on the position of their, their ability to
Fatty.
be liquid state or a solid state. Now, traditionally, India and our ancestors were very wise. Our people had introduced fats in such a way in our diet that they gave us the fats coming from either coconut
Hmm.
or dairy, what they call is the ghee. And the
Right.
ghee contained ideal ratio, it did not contain any polyunsaturated fats. But they condemned ghee saying that it hardens the arteries, which was actually wrong. It is only excess ghee. Excess ghee, which the people fried items in ghee and used tons of ghee in a day. That was bad. 2 teaspoonful of homemade ghee is beneficial. Anything more than that, and frying in a metal kadai, deep frying, combines it with the oxygen in the environment and causes what is known as cholesterol oxidase, which is highly atherogenic, carcinogenic, and harmful to human body. So ghee, if you must eat, you should eat ghee as a garnishing on the top of the food stuff. Even coconut also should be garnished. One should not do anything deep frying in coconut oil and restrict the oil to 2 teaspoonful per day per head and 2 teaspoonful of ghee per day per head. That's the right quantity of ghee that you should consume. And this is the big, discussion on omega 6 versus omega 3. Now, all vegetable oils are rich in omega 6. All substances from marine fats like fish, mackerel, salmon, they have optimum ratio of omega 6 to omega 3. Any ratio of omega 6 to omega 3 more than 5 is dangerous.
Right.
Lesser the ratio of omega 6 to omega 3, the healthier is the fat. But
Okay.
one must restrict the total day's consumption to what the kitchen language in 2 teaspoonful of oil. The best oil that we recommend is not the corn oil or safflower oil, but we
Rice
use
bran.
rice bran oil, 2 teaspoons. And between buffalo and cow milk, we don't make much difference. And 2 teaspoonful of carnel or cobra to garnish the dishes on the top. So
Right.
that is the right way of eating. Now, one should do a restriction that I will not buy the packeted food. The packeted food, which is I've added preservatives in that and contain excess salt to make it palatable as well as to increase the shelf life. All packeted food which is consumed by children, which is detrimental. The food
Right.
should be made at home, wholesome food. Gone are the days where children are eating polisa ladu, and potije pohe. All this stuff people have forgotten to eat. They all
Absolutely.
buy, they have got a pocket money, they go and buy packeted foods, and the packeted foods have a lot of problems. So,
Absolutely.
if you want to make a resolution, say this year I will not eat packeted food.
Hmm.
I will not eat farsan, sev, gathia, papda, bhajia, pakoda. I will stay away from it. But again, let me tell you that by making a resolution and making some kind of a big prana, like this year, I will not touch bhajia. That's the wrong thing to do. Bhajia on a day of occasion, once in a way, once in 15 days, you can have two bhajias. Nothing wrong in that. A lot of people say, I will not touch sugar. So that's good because it's a carbohydrate without any nutrition. But the point is, one can take a teaspoonful of sugar in a day. If you want your first cup of tea with a 1 teaspoon of sugar, we allow that. But you cannot have sugar in every substance. And
Right.
particularly for children, I'll tell you why. The children at a young age, we lure them if you stand first in the class or something like this, I'll give chocolate. They are all rewards are associated with sweets. So
Right.
what happens in children when they eat sweets over a period of time, they develop a anatomical center in the brain
Hmm.
of sugar and fat, particularly cheese and butter. They develop a center in the brain. That center keeps on demanding the children that you have to have cheese, you have to have this, you have to have butter, and the child cannot eat any other food unless it is laden with this stuff. And that is the main cause of childhood obesity in our country.
Absolutely, sir.
So
Absolutely.
this is my mantra on diet.
Okay. And what would be the best exercises for a long-standing middle-aged diabetic, according to you?
See, exercise is done for three, four reasons. Exercise to show off your muscles. They are done with weights, with isometric as well as isotonic exercise. Then there are exercises which are designed to increase your cardiorespiratory fitness. Your heart must pump several times more than your normal. Say, for example, your heart rate is on a resting pulse is 72, and you want to give it a cardio fitness. You
Right,
must
sir.
increase the exercise in such a way that heart rate must go up from your 72 plus your age. So you are 50, then you are allowed to get your heart rate up to 120 without any problems. This you do it if you are above the age of 40. You must first, if you are going for a walk or jog. Now, jogging is a bit strenuous exercise on your joints. So, you must have a complete physical examination by a good physician, by a good orthopedic surgeon if you have some orthopedic problem like arch of the foot, like knee joints, most important, most vulnerable joints during jogging are knee joints and hip joints. They must be fine. There is no deformity or disability. And you must have sufficient muscle mass in the lower limbs. You must have good
Yes.
quadriceps. You must have good hamstrings. You must have good gluteal muscles. So you should be able to walk without any pain. If walking gives you pain, another thing that you have to keep in mind, all diabetics must get a thorough foot examination by a foot specialist to see the pressure points on the sole and to see if there are any kissing ulcers or any callosities which can predispose you to foot ulcer, and that's a dangerous thing to do. So,
Yes.
detailed analysis of foot and invest almost 16, 17,000 rupees in a good shoe wear. The shoe size should be one size bigger. Always go to purchase shoe in the evening when a foot is slightly swollen in the evening. And it should be one size bigger. Suppose you normally wear 7 size, you wear 8 size, so that one finger can easily move behind the back of your heel. Once the shoe is purchased properly, wear a soft socks, and after the walk, make sure there are no pressure points. Many times the sensory system in the lower limbs, particularly sole, is poor. So you may have to inspect your feet daily. You must see your feet daily, like your face you may see 10 times in the mirror, but night you must examine your foot and the sole thoroughly to see if there are no pressure points or ulcers. So this is
Right.
a care you have to take before you undertake exercise. As I
Perfect.
told you, the heart rate must go up. You must not feel tired. Please remember one thing. If you feel tired and don't feel like going for work in the morning after the exercise, there is something wrong with your exercise. Exercise ideally should give you a high. Exercise produces what is known as beta endorphins, your body's own morphine systems, and you must feel elated. People who take exercise, their face is always very cheerful. You look at our prime minister; he gets up in the morning at 4 o'clock and does yoga and exercise. The whole day, his face is cheerful and alert, and is looking so pleasant only because of regular exercise, which does not tire him out. If the exercise tires you out and feel like taking a blanket and going to sleep, there's something wrong. You will have to change, or you have to take to a therapist. You may have to go to physiotherapist to ask whether you're doing the exercise in the right way. After the exercise, if your joints aches and pain, little ache and pain is okay when you're starting new. But they keep on aching permanently or on a regular basis, there's something wrong with your exercise system. So these
Right.
precautions you have to follow.
Sure. So most of our patients sometimes they complain that when they go for the exercise, once they come back, they have drop in sugars. They experience a lot of tiredness. So, would you advise them that before they have their workout or exercise, they should check their sugars,
Yeah, that's a
adjust
good
their
question you asked
doses?
me, Nadia. That's a common problem. People, particularly who are tightly controlling the diabetes, because all associations and all organizations now insist on a tight control of diabetes, so
Yes.
HbA1c of less than 6.5. In
Yes, sir.
order to do that, many times people go overboard and they can reduce their blood sugar less than 100 many times. And particularly after exercise, if you don't take this into an account, your blood sugar may be going before exercise, say 140, and after the exercise it drops to 90. You may feel faint, you may even fall down during exercise. So it is better that when you go for exercise, you must have some snack in your pocket and some snack you have taken prior to going to exercise, about 100 and 150 calories. Either a small piece of bread with a slice of maybe a little butter and a cup of milk. Don't go completely empty stomach for exercise, and carry some, because the moment you feel slow, it is better to assume that your blood sugar has gone down than to increase your tablets or insulin thinking that it has gone up, because going low can be disaster. Going up on 10 occasions also may not cause you immediate problem, and therefore one must rule out hypoglycemia. And if you have this hypoglycemic symptom more often, you must consult your doctor, because that's the time you have to adjust the oral hypoglycemic agent or doses of insulin. This is a very important thing, particularly long-standing diabetics. They have slightly abnormal renal functions. If
Right.
the kidney is not functioning 100% normal, the half life of a drug increases. The drug clearance from the kidney is slightly slow, and the drug lingers in the body longer time. And instead of action lasting for 12 hours, it may last sometimes 16 hours. Now, there are a lot of new drugs which have come, they are really long acting drugs, and that has to be kept in mind before you start the medicine, or when you are on this medicine. You monitor your sugar more frequently to see that you are not going into hyperrange. That's a
Right.
very important.
Absolutely. So we even see that, like, if our patients don't sleep well in the night, the next day they may have high sugars. So, any advice for the discipline, sleep discipline?
Now, sleep is a greatest gift of God to man. The sleep has got three important factors. It causes complete restoration of your systems. It causes complete rest and regeneration of your cells. It also gives a tranquilizing effect to your brain. It also reduces the load on the heart. However, there is one problem with almost 40% diabetics have after the age of 40. They have what is known as obstructive sleep apnea.
Yes.
When the people sleep because of loss of sympathetic tone and general tone of the muscles, the soft palate, the arch of your throat falls on the respiratory passage. And in the sleep, your respiratory passage gets partially blocked, causing what is known as obstructive sleep apnea. And this sleep apnea can result into sudden awakening, or it can suddenly cause obstruction to the airflow, causing a lot of cardiac dysrhythmias. Atrial fibrillation flutter can happen in sleep, and sometimes you can have early morning sleep apnea resulting into sudden death. And that is why every diabetes must do his sleep study, particularly if the spouse, the person who's sleeping with this person, complains that this fellow snores a lot,
Hmm.
or suddenly in the night he gets awakened with
Hmm.
a startle. Many times, remember that not all snorers have sleep apnea, and not all sleep apnea patients snore. So
Right.
snoring can be variable, but if the person tells that in the night suddenly wakes up as a startle, this is a dangerous sign. So do a proper sleep study in a lab and find out whether you have what is known as apnea hypopnea index. Okay, if it is more than 10, you need a CPAP machine, which is a forceful expiration when you are inspiring in the sleep, 18 per minute. It pumps in oxygen from the environment. You don't need to connect it to oxygen cylinder, but it gives you a proper flow of air in your respiratory tract, and that can avoid so many. In fact, people who use a CPAP machine regularly, I have seen their lipids becoming normal, their blood sugars are under control, they don't have many cardiac dysrhythmias, and therefore this is a very important test one should do before you really. And a machine for CPAP is not very expensive. It's a good investment considering the benefits it offers. But
Right.
I always urge a sleep medicine has evolved enormously now, and therefore before second thing, the sleep should be in a quiet place, away from light, away from noise, and it's always better if your partner is snorer, then it is important that you must sleep separately. Now that's a luxury in our city of population. But if you want to have a really sound sleep, ideally you should sleep alone. The next day is very refreshing, but it's not possible everyone. But you can have a proper partition, and the best is get your sleep study done.
Right. Good, sir. Perfect. So, can we educate our viewers about the type of medications that we have nowadays for diabetes, the
Oh,
insulin?
there is a explosion of oral hypoglycemic agents. Practically every company has got one or two product,
Right.
and there is a fierce competition. Basically, the drugs are divided into two simple agents. One are insulin secretagogues, means they stimulate your own pancreas to produce your insulin at the optimum level. Many people have insulin deficiency. They don't have insulin absence. The pancreas do produce some amount of insulin, but that insulin is not adequate for their diabetes and their
Right.
metabolism. So there are drugs like sulfonylureas and all. They stimulate your own pancreas to squeeze more insulin out of the pancreas beta cells. Now, obviously, there is a limit to which these drugs can squeeze it out, and there is
Yes.
a limit for the beta cells of your own pancreas to respond to the stimulator. A time comes when the beta cells are fatigued, or there is early apoptosis, earlier programmed death, and they stop producing insulin in spite of the secretococcus. The secretococcus will not help. Insulin sensitizers, on the other hand, utilizes your native insulin. Your body has got to produce insulin. Somehow it has to act on its target, like fat cell, muscle cell, liver. That target sensitivity is lost for some reason. There is insulin resistant. And India has got a phenotype which is born, we are insulin resistant people. Why insulin resistant? Because we have abdominal fat, we have visceral fat. Our BMI is 21, but our waist circumference is 80 centimeters. All our fat is in the viscera, which is an unhealthy fat. That is the cause of insulin resistance. Now, if you want to improve that, there is a simple drug known as metformin, which are traditionally used, but a lot of side effects. But there are many other sensitizers which are available now. There are some, they are incretin mimetic drugs. There are sitagliptin, saxagliptin, lanogliptin, all there are gliptin. These gliptins about 8 or 9 varieties. Then
Hmm.
comes the drugs which act to the GLP-1 agonist. Then there are drugs known as SGLT2 inhibitors. What are SGLT2 inhibitors? Now, insulin, which is detoxicated, deactivated by your kidneys, and also the kidneys do a job of reabsorption of sugar. Whatever the sugar is thrown out in the kidney, which is reabsorbed and goes back into circulation.
Yes.
Now, this kind of a excretion of sugar in the urine is a symptom of diabetes, polyuria,
Yes, sir.
polydipsia, thirsty. Actually, this is a cause of all the variety of symptoms of diabetes. Now, SGLT2 inhibitors, they prevent this reabsorption of sugar and they circulate the sugar back into urine in a large amount. So once you put on this drug, the patient passes enormous amount of sugar in the urine and that sugar is actually lost. It is not that fuel is not utilized, but it is lost and that's where the sugar comes down. So this is a new drug. It has only one side effect. You pass a lot of urine which contains
Yes.
sugar and can invite infections, particularly in females, in the genitourinary tract, causes a lot of infections with the bacteria.
Right.
Now, this is a new drug, but it has helped two things. One, when you lose a lot of sugar, you lose a lot of water. That much water is lost from the body, and your volume on the heart, say you normally have a 5 liters of water, 5 liters of blood circulating in your body, and you have 6 liters. Supposing the water has increased, extracellular, the intracellular water has increased. That water is thrown out, so it helps to reduce the load on the heart. So nowadays, you see the SGLT2 inhibitor as a first drug on the prescription of cardiologists
Hmm.
because they find a lot of other benefits than only sugar reduction, of blood pressure reduction, of volume depletion, improvement of the function of the left ventricle of the heart, including effort tolerance. So this is a good drug which has come up and it is used. Second thing, this drug can be combined with many other drugs like sulfonylureas and metformin. So this comes in a combination pills with a lot of other drugs. So this is about oral drugs in short.
Right, sir. So, and what about insulin? Because most of our patients are nowadays, the CKD especially, they have to go on insulin. So, little information on insulin and the types.
Insulin is a really Sanjeevani of 21st century. Before insulin, the type 1 diabetics, the physician would say, a great man, Jocelyn, who is the father of diabetes, he said that before the invent of insulin, discovery of insulin injection, they used to just count the number of days the boy is going to survive. I mean, that was the span. Then it was used on a young boy, 14-year-old, make a breakthrough. Out of eight or nine scientific Nobel Prizes, almost four or five are given to insulin and insulin manufacturing. The great advance is recombinant DNA technology. There was a time when people thought that insulin was obtained from cattle, and the cattle were slaughtered. Cow insulin, bovine insulin, pig insulin. Then what happened? The people felt that a time will come when the cattle will be over on the surface of the earth, and you will have to kill. So the man will kill man to obtain insulin. Such a thing never happened because of the search of a recombinant DNA technology. You can convert a batch of E. coli, which are the organisms in the urinary tract infection, to by genetic engineering in a synthetically prepared insulin. And there are tons of insulin available now for man. This is a great event in the management of diabetes, availability of various types of insulin. Now, insulin traditionally are short acting, intermediate acting, and long acting. To protect their action, we had to combine it with either zinc or we have to convert into lente. Now there is a prolonged long acting insulins which are made by genetic engineering in such a way that now the injection, a single dose will last for almost 24 hours. The great long acting insulin availability now in the hands of a common man. To potentiate this action pre-meal, we have a two-arm insulins, either co-formulation. Co-formulation is not a mixture. Co-formulation is like when you see at Rudraprayag from the air or helicopter or flight, you see Ganga and Jamuna flows separately for a long time. The water does not mix because Yamuna water is black and Ganga water is white. You see two different streams, and that is exactly the funda of co-formulation, where both the insulins retain their properties in spite of
Hmm.
making into a formulation. It's not a mixture. It does not get combined, but it stays separately. And when you use that, you have a short acting arm and a long acting arm. Long acting arm work for 12 hours, 12 to 16 hours, while a short acting acts just prior to meal. So you can give before breakfast, before lunch, only short acting insulin, and before dinner, again short and long acting, small amount. There is another one variety now, which is known as rapid acting, fastest acting analog of FEASP, which can be given in some patients even after lunch. If you see the postprandial blood sugar, we must somehow keep a target of blood sugar of post lunch less than 200 at all times.
Right.
Now, this does not happen in all the patients because sometimes the carbohydrate intake and our diets are mainly carbocentric. So, at a big lunch or even a normal lunch, the postprandial blood sugar goes more than 200. Then you have to bring it down. Now you can't give him a regular insulin. You can give this shortest acting analog, which can easily bring down the postprandial blood sugar to less than 200, even if you give injection, a small dose after lunch. So these are the new development in the insulin therapy. The insulin pumps are available where you
Yes.
can continuous infusion. Can the people can avoid need to 6 7 injections in a day.
Yeah.
This can be given. So there's a lot of technological advantages. So technology and artificial intelligence is playing a great role in management of diabetes with therapy, particularly therapy.
Absolutely,
This is
sir.
very important.
Thank you so much, sir, for giving us your time today and sharing such valuable information to all our viewers. We end this session here. Thank you, everyone, for joining us.
Thank you. Happy New Year to you.